Avian influenza. How much do you aware about it? What is an avian influenza? Avian influenza is a disease caused by the infection with avian, bird, influenza flu type A viruses. It is originated from the infected wild water fowl that undergo antigenic shift mutation, causing it to rapidly spread to poultry, mammals, and humans with no immunity. How can we get infected? Infection may occur when we in close contact with the infected birds, eating the raw infected bird or even the intermediate host, touching their body discharge such as their saliva, nasal dispose and their feces, or even touching surface contaminated with the virus. What is the sign and symptoms of the disease on human?
Hey, just came back from the barn?
Yeah, I have to check out all the chicks again.
It's all good as always, I guess.
Well, I don't know if it's good or not, but 3 dozens of them just died out of nowhere this morning. Some of them even refused to eat while some others got diarrhea.
Then what is your plan?
Just done sending all the evidence to the lab for further disease identification and analysis. Excuse me.
Maria, you okay? You look pale.
I don't know myself. I started getting a fever since last week and my whole body aches so bad. I thought it was just a usual mild fever, but it never subsided, and just yesterday I caught with sore throat, which as you can see now developed into coughing.
Have you been to the clinic?
Planned to do so but never had time to do it.
Just take some leaves and go to the doctor. What is more important than taking care of your own health?
What is the available treatment? The treatment for avian influenza works either by using drugs targeting the influenza virus or drug as a symptom reliever. One of the treatment is by using antiviral. What is the antiviral for avian influenza?
Okay, Rooney, since you have missed my previous class, today I'll tutor you myself.
Thank you, Miss Latifa. I'm so sorry for causing you trouble.
It's okay, but remember to take care of your health next time.
I will.
Let's start our class this evening with the topic antiviral as treatment for avian influenza. For starts, we are going to learn only one of the antivirals today, which will consist of the dosage form, dosing, and pharmacological aspect of the drug.
What is the drug, Miss Latifa?
The name of the drug is oseltamivir. It is an antiviral patented under the brand name of Tamiflu. Generally, oseltamivir works by blocking the actions of influenza A and B virus in your body.
Okay, but how?
Oseltamivir works by inhibiting neuraminidase enzymes that trigger the release of virus from the infected cell, causing the virion to trap in the respiratory secretion.
Noted that, but how is it got metabolized by our body?
Good question. Oseltamivir should be absorbed in the GI tract and then ingested into its prodrug form, oseltamivir phosphate. Later, the prodrug will be converted by hepatic esterolysis into its active form, oseltamivir carboxylate, with higher bioavailability and longer half-life to inhibit the viral replication.
How about its secretion out from the body?
The drug will still be secreted out from the body in its active form through renal secretion in the form of feces.
There must be some kind of side effects, right?
True. Its side effects vary from the common effects like diarrhea, dizziness, and vomiting to experiencing allergic reaction. Some even have difficulty in sleeping or even breathing.
How can we reduce the effect?
We can simply reduce the effect by taking the medicine with food. However, oseltamivir should not be taken in close interval with any live attenuated vaccine, as it will cause them to be ineffective due to its viral replication inhibiting action.
I see. So how about its dosage and dosage form?
Oseltamivir is prepared in oral capsule and suspension form. The recommended dosage for prophylaxis of avian influenza in adults and adolescents is 75 mg per day for at least 10 days, while for pediatric less than 1 year age is 3 mg per kilogram every day for 5 days.
Get that. So is that all for oseltamivir? What are the alternative antiviral for avian influenza?
Yes. We are done for oseltamivir, but later in the next class we will discuss about the alternative drugs, which are zanamivir and piramivir.
Oh. Okay, then I shall see you next time. Thank you, Miss.
What are the prevention steps? The most important prevention steps is to avoid the source of exposure to the virus whenever possible. This can be done by cooking the poultry and eat egg properly before eating them.
Created using Powtoon.